if you suffer from headaches, it'll be key to listen tonight because we're going to talk about a headache that is very common, occurs in about 15 to 20% of the population, but it's very commonly missed. I'm Dr. Sarah Swall. I work at Resilience RX, and tonight we are going to talk about headaches. So the specific headache that I want to talk about is a headache that doesn't come from the head. It comes from the neck. If you want a fancy term, we call it a cervicogenic headache. Cervical spine, genic coming from cervicogenic headache. Now this headache comes from the top part of your neck. So if you're going to list the vertebrae in order, we have C1, C2, C3. This comes from that C1, C2 area. And it basically just means those two vertebrae aren't moving very well on each other. Those two vertebrae are responsible for the large majority of this rotational movement. So when there's dysfunction there, typically turning the head hurts. The most characteristic pain associated with this, though, is pain right at that base of your skull on either side that extends upward like this. It'll end around your eye, your nose, kind of diffusely. You may have kind of like facial itchiness, numbness. Some people complain of teeth pain with this as well. And this is because the nerves that innervate that area of the face overlap with the nerves in your neck, which can make this pretty confusing for some providers who aren't aware of that distinction. So if you suffer from headaches from here to here, one of the things that you can do is take 2 tennis balls, stick them in a sock, place them at the base of your neck and kind of do some self-massage, move it back and forth, essentially getting motion in that area. We want to increase the fluid, the motion to that C1, C2 area. You can also find your spine in the back. There's a pointy part that sticks out and you can push that side to side. That typically helps too. I will do the caveat that it's not super comfortable, but it does increase motion there. Another really good option that this responds really well to is actually a neck cavitation, neck manipulation. So seeing a chiropractor or physical therapist, this is one diagnosis that hands-on treatment can get you a lot further, a lot faster than simply working through things on your own. So if you're very frequently getting headaches in this shape, then I would suggest going to see someone, whether it's a chiropractor, physical therapist, someone who has good hands-on skills, who can crack your neck and get things moving better. If you do not feel comfortable getting your neck cracked for whatever reason, you can still get good results, but this is one diagnosis that typically resolves a lot better if you see someone and get some assistance, because a good chunk of the treatment is hands-on skills to get things moving better. So if you have any questions or you suffer from headaches, feel free, shoot me a message.